Right, so we're looking at the management of hyperosmolar hyperglycemic state. So we spoke about this as a complication of diabetes mellitus. We said somebody has type 2 diabetes mellitus. Now, because they have type 2 diabetes mellitus, they have small insulin in state, to basically break down glucose, but the insulin is not okay. So the body is not really opting in for ketones for energy. Do you understand? So we said glucose levels are high, but the body is not utilizing ketones yet. Do you understand? So it's a non-ketotic state. So for the management options, general measures is basically you have to calculate serum osmolality. You have to establish that. We say one of the features of hyperglycemic hyperosmolar state or hyperosmolar hyperglycemic state is what? The osmolality is high, more than 320. So you calculate and establish that. Then you do fluid replacement, where normal saline is the fluid of choice. So fluid replacement, okay? So insulin replacement, that this person, probably has insulin, but the receptors are resisting it. Maybe the insulin is not much, so you put plenty insulin. All right. So commence insulin therapy only after rehydration has started. Okay. Then correction of electrolyte imbalance. Treatment of precipitating factors. Sometimes the patient has this issue, but is on the lay low. It only bursts up if some one or two things trigger it, like myocardial infarction, cardiovascular diseases. So prevention of complication is prophylactic anticoagulant. All right. Then subcutaneous heparin. Do baseline clotting profiles and all of that. Okay. So that's just it for hyperosmolar hyperglycemic state.